All right. Welcome to the Dr. Doug Show, where I bring together two critical components of self-mastery, HealthSpan and mindset. The topics presented here will help you to improve both your body and your mind and to help you to live better, longer.
3, 2, 1.
Here we go!
Have you ever felt like you're just drifting through life, like a leaf carried by the wind and there's no control over your destiny? If that question made you pause, you're not alone. Today, I'm going to dive into the concept of drifting, as was discussed in the book Outwitting the Devil by Napoleon Hill. I want to define this. I want to show how common it is and how it relates to your health. So stick around because this might just be a wake-up call for you and really the wake-up call you've been waiting for. So most people actually drift through life. They get caught in routines, habits, thought patterns that lead them nowhere. Like ships without a compass, sailing aimlessly through a vast ocean. I've seen this in my patients' lives for years. I really wasn't able to understand it or explain it until I saw it in my own life, and I read it in Napoleon Hill's book, Outwitting the Devil. And some funny things about this book is that it was actually written in 1938. So if you listen to it, you'll see that there's some really interesting context from what was going on in 1938. But what's amazing is how it has persisted and relates to what is going on in our world today. And this is 2023. It wasn't published until 2011, long after the author's death. Why? Well, what's interesting is the author's wife, who was very concerned about the content and the nature of the book, wouldn't allow it to get published. And then the board that went along with the company, because he made such a tremendous amount of money through his books and writings and et cetera, they wouldn't let it come out either. What's controversial about it is that it was written in a style that is somewhat unique. And it's essentially the author, Napoleon Hill, having a conversation with the devil and discussing the devil's secrets with the devil himself. So in the book, the devil goes on to tell the author exactly how he uses social constructs like organized religion and the education system to change people's perspective of their life, to encourage people to drift through life. And as people are drifting, then the devil then can do what the devil does, right? And man, there are so many ways that you can take that, depending on your religious background or secular background or whatever. But one of the things we talk about in our practice is having some kind of a spiritual foundation. And again, this can be secular, this can be religious, it doesn't matter. But one of the things that's important about that is that if you are drifting, then you are deficient in that pillar. And having some kind of a higher purpose and mission is what we're going to talk about here. So if you go back to this book, remember this was in 1938. And I think what's amazing is that he talked about the education system, which I think is under a lot of criticism right now, as it should be, but also social constructs like religion, social constructs like government. So imagine, how you could apply that today if you were to rewrite that book almost 100 years later. Let's talk about drifting. So I look at drifting as one of the most common reasons for people to fail to achieve their purposes in life. So basically, it's like letting external circumstances dictate your actions rather than taking control. Where I see this strongly coincide with my patients in our ability to achieve optimal health is that our actions around the decisions we make around both addictive substances and behaviors, because these behaviors are becoming more and more common that allow us to drift. We're basically in a drifting or addictive society. So to point this out, that according to the Substance Abuse and Mental Health Services Administration, it's estimated that nearly 21 million Americans age 12 and older struggle with a substance use disorder. This was back in 2019, pre-pandemic, probably much higher now. Those numbers include addictions to alcohol, tobacco, and illicit drugs. I think that number is woefully inadequate, because remember that we're looking at in those numbers people that are diagnosed or admitted to substance abuse centers, and they're considered substance abuse cases. What I see over and over again is that there are innumerable cases of substance abuse, behavior abuse that are passing for socially acceptable. And this is where it gets very, very challenging to start to define what an actual problem is. So let's just start with one of the big ones, alcohol. Now, this makes me relatively unpopular, but I look at alcohol like this. It is one of the most commonly abused substances. According to the CDC, excess alcohol use is responsible for more than 95,000 deaths in the US each year. I'll do an entire episode on alcohol in the future. But from my perspective, there's just really no space for alcohol in an optimized life. Let's just assume that we are generally socially accepting of alcohol in our society, and that I'm a rare entity in viewing alcohol as something that shouldn't exist in our lives. But let's just assume that it is accepted, because it is. And yet it causes almost 100,000 deaths a year. So name me any other substance that directly causes that many deaths that we actually seek refuge in on a regular basis. So we'll come back to that. What about opioids? So the opioid crisis has really been in the spotlight for the last several years. As somebody who has prescribed opioids as a surgeon, I know very well the impact that opioids can have on people. There's an estimation that approximately 10 million people age 12 and older have misused opioids. And again, this is data from 2019. I think, unfortunately, this has continued to get exponentially worse, not only because of the same pathways that were being exploited in 2019, but also now because of the additional pathways of fentanyl and overdoses that are occurring because of the crisis at the border, because we have fentanyl coming in previously unavailable products that can be in anything, and the dosages of fentanyl that are being consumed are unfortunately very, very high, very toxic and fatal. So I think those numbers are going to get a whole lot worse as we start to look over what's happened over the last 5 years. So opioids, just like other substances of abuse, have become easier to get. And they are a very popular way for us to change our mental state. Opioid deaths have gotten easier to track, increasing attention, but they are just one of what I would consider many substances that are used for this similar purpose. So now that we've talked about alcohol and opioids, let's talk about this concept of addiction. So let's define addiction from my perspective. Now, there is a medical definition. There's a DSM-4, DSM-5 definition, which is the basically the handbook for psychiatrists, right? So there are those definitions, but basically what we're taught in medical school is that addiction is something that has these components. So there is a compulsion. So it is a behavior or substance that leads to a compulsion. The compulsion is a strong and often irresistible urge to engage in the behavior or use the substance, all right? There's a loss of control. The loss of control is a difficulty in controlling the behavior or substance. And this could include difficulty in controlling the frequency, the duration, or the intensity. There are negative consequences. So continued engagement or continued use in the behavior or substance results in some kind of adverse physical, psychological, or social impact. And tolerance. Now, not all addictive substances provoke tolerance, but some do. And tolerance is simply needing more of that substance or behavior to achieve the same desired effect or to experience the reduced effects when using the same amount. And so you see that, of course, in opioids, in other drugs, in alcohol, et cetera. And then withdrawal. So again, not all drugs or things that are addictive meet this criteria, but many will. And withdrawal is a physical or psychological symptom that occurs with reduction or stopping of that behavior or substance. So again, there are both addictions to substances, and then there are addictions to behaviors. The substance addictions are things like alcohol, drugs, other chemical substances. Behaviors, and this crosses over to some extent, but behaviors are things like gambling, eating, we'll talk about sex, internet use, pornography, etc. So All right. So those are the clinical definitions, but let's define this a little bit more. So let's talk about something like happy hour, right? It's Friday. Today's Friday as I'm recording this. Coming up on it's almost 3:00. So 3:00, people start thinking, hey, man, it's Friday. It's happy hour. Does happy hour fit this criteria? Well, does it cause a compulsion? Well, I'm thinking about it. I'm actually not thinking about it, but let's go back 5 years. I'd be thinking about it. Would I potentially lose control in a Friday afternoon happy hour? Well, we haven't talked about my history of drinking, but the answer is yeah. If I went in and thinking I'm just going to have one before I head home, the reality is that I would probably have two or three. Would there be any negative consequences? Of course, both short and long-term consequences. And you already know them, right? You are already aware of what's going to happen. And so you can see how all three of those things are true for something as simple and socially acceptable as, hey, let's get a drink after work. What about something like TV? Do you have any compulsions to watch TV? Do you want to watch that show on Netflix? Do you ever lose control and watch maybe more than one episode? Are there negative consequences? Do you stay up later than you're supposed to? You binge watch an entire season in one night and you wake up the next day and you go, oh man, I'm tired. Yeah, it happens, right? What about something like coffee, right? I love coffee. Do I have a compulsion for coffee? Yeah, I do. I go to sleep thinking of waking up the next morning about coffee. Now, here's the thing though. I don't lose control over coffee, right? Like I have 2 cups of coffee in the morning. I don't want more than that. I have a self-limiting behavior around coffee. So I don't consider coffee to be an unhealthy, quote unquote, addiction for me. I don't think it meets the criteria. Are there negative consequences for me? Not that I can really not that I'm aware of. I'll put it that way. There's some theoretical ones, but I'm not willing to reduce my coffee consumption to potentially offset those. Those are some examples of where some very socially acceptable things are going to be considered potentially addictive and potentially things that we might want to talk about if our goal is to optimize our health. And we'll get back to what this has to do with drifting in a minute. I also wanted to mention some other things. We talked about a few behaviors. And so I just wanted to mention some behaviors because there are things like I always talk about gambling, and boy, I don't see it in my patient population. I know it is probably a big deal because I hear about it all the time. But what I see in my patients is, let's call it social media use. Let's call it phone use, right? Like I'm always on my phone. Whenever I have to go to the bathroom and I have 5 seconds to like not be just encompassed by some kind of work or person or something, what's the first thing I do is I reach for my back pocket and I grab my phone, right? Like that is a compulsion. Do I ever lose control? Yeah. Are there negative consequences? Of course, right? So like that is an addiction without a doubt. I'm involved in a bunch of different men's groups. And one of the things that always comes up in men's groups is pornography because it apparently is a really big deal. And a lot of men have a hard time getting away from it. And it is a compulsion. There are negative consequences and people lose control, right? So like you see these kind of behaviors like happening over and over and over again. And then there's food. And man, we live in an addictive culture of highly processed foods that are designed to be addictive. And the reason why they're designed to be addictive is because they are these unnatural combinations, a high fat, salty, high carbohydrate thing, right? Or a high fat, high carbohydrate, baked good. Like those things don't occur in nature and they're so addictive to our brain and they're designed that way intentionally. So we can call it whatever we want, but ultimately we're surrounded by addictive substances and behaviors. And sadly, the impact is more than just profits for companies. It's physical disease. It's mental disease. And sadly, I also see this in a lot of the groups that I'm in and that I've been involved in, which is mental disease and then leads on to suicide. And so the reason why I bring this up, and it sounds a little dramatic, but I see this spiral of people being unhappy in their life, this drifting behavior that then ultimately leads to people, questioning their role. And you see people that are committing suicide that are seemingly doing really well. So there's actually over 700,000 deaths annually in the U.S. And this is drug overdoses, alcohol overdoses, and suicide combined. It's hard to separate those things out, but wow, it's a lot of people. And so if you know, or if you or anybody has been thinking about these, kind of helpless feelings and need help, there is definitely a path to go. So there is a suicide prevention lifeline. We'll put this in the notes, of course, as well, for those that are looking for this number. But it's 1-800-273-TALK. So please feel free to pass that on to people, because this is something that is not easy to talk about, and people don't ask for help often enough. So there are certainly resources. So don't be afraid to reach out. They are protected, and so you can reach out without any concern that anybody's going to find out who is calling them. So please do that. Okay, so then let's get back to this mindless downward spiral. So this drifting, this mindless downward spiral, I think that for me and for those around me that I've had these very in-depth conversations with, what's happening is that we've lost our purpose. We've lost our mission. And I'm going to tell my story and how this happened, because I know it best. But to reverse this, you have to first figure out and ask yourself some hard questions to do so. What is your current starting point? What are you passionate about? What is your purpose? What are your strengths? What does the world need that you can provide? And if you don't know the answer, that's okay. But asking somebody, working with somebody to help you. So again, I'm going to spare my patient stories because I don't know them as well as I know my own. And my own story is actually a pretty good story for something like this. So my story is, and this will be a little bit in depth and personal, but my story is that by any measure, and like most of my kind of high performing colleagues, I would be considered a success, right? Stanford trained orthopedic surgeon, busy, successful practice, beautiful wife at home. We built a custom home in a mountain town. We have 2 amazing boys and another one on the way, 2 dogs. I mean, you're talking about the American dream, right? However, like, as I've learned later, so many of my colleagues and eventually my patients, I felt a little purposeless, a little passionless. I'd achieved all these goals, but I never really identified my mission. I didn't know what the term drifting meant, other than something you do in a car, or at least not that I could do, but what people can do in a car. I didn't know what that meant at the time. I wish I did, because I could have seen a lot of these things coming. But what I did, and what so many people do, is to create this mindset of victim mentality or victimhood. And it's a mindset that then looks for escape. So what's interesting about this, and I see this in my patients again all the time, and we have these conversations, we really get into some deep stuff with our coaches. But as a victim, when you start to create this mindset, as a victim, you can really justify just about anything. Any behavior, substance use, abuse, actions can pretty much all be justified, or at least you can justify them in your head at the time. Now, fortunately for me, with God looking over my shoulder, I was drifting into what I would now describe as an unhealthy relationship with alcohol, TV, food. But these were all completely justifiable by social standards, right? Like, I wasn't snorting cocaine off of strippers or showing up to work drunk. I was just living the American dream. But that's the problem, is that it's all so acceptable. And yet, when I look back now, what I see was a total escape. I had a failure to identify a purpose and to modify my purpose and passion over time. I had a mission when I was training to be an orthopedic surgeon, but I failed to update that adequately so that when I got into practice, I could understand what my purpose was. Even though I was seeing patients doing a lot of good, I had lost my mission. I had lost my mission both professionally, personally, and with my family. Even though I had plenty of things to be passionate about right in front of me. I'll say them again: loving wife, adorable children, successful career. I could have latched on to any of those things, right? I could have pursued a better relationship with my wife, with my kids. I could have done something different at work. I could have gone down so many different pathways, but the draw of addiction, the draw of substances and behaviors is so powerful, and the comfort of a victim mentality even more so. So what I find is that people will follow these really misdirected paths, even though so many great things can be sitting right in front of them. So I found my way out through a series of events that I'll describe another day. This pathway through addiction and recovery that I very much look forward to sharing. And for today, I'll just say this, that I found my passion, I found a mission, and everyone around me is better for it. Again, by the grace of God, I'm still married. I'm still a physician, trying to be the best father that I can be. And my role in all of these circumstances are now very different. If you are looking to live your best life, it would behoove you to be around those that are trying to do the same. If you haven't heard yet of our HealthSpan Nation, I strongly encourage you to go down to drdouglucas.com, check out the HealthSpan Nation. Basically, it is a weekly Zoom or meeting online with a Q&A with myself, with some of my team members. It's where we put our resources. There's a group area where you guys, people interested in living their best lives, can work together to talk about these different resources. So one way to surround yourself with the people around you that are trying to live their best lives. All right, so how does this relate to you? Well, again, I don't know if this is you, but it starts with a wake-up call. I see this so often in those with identified addictions like alcoholism, drugs, other behaviors. And I want to point out that you might hear these stories about hitting rock bottom. And again, I'll describe what I would consider my rock bottom another day. But it can mean a lot of different things to different people. And I've heard some really crazy stories. But for most of my patients and for myself, rock bottom isn't that spectacular. It doesn't necessarily make for a great story. And honestly, for most people, it probably shouldn't be shared. Rock bottom can look like simply just a realization of reality. What is going on in my life? Where have I lost my way? What is my purpose? What do I want? Am I living a wanting life, or am I living a needing life? What is my unique gift? There's so many different ways to fill that void. And again, I'll share mine as an example of successfully coming out of this because I know it best, but also because you can consider it a caution to timing and impact. So my emotional rock bottom was filled with despair, depression, anger, resentment, all of these super fun emotions that people get wrapped up in. I could feel it. Those around me could feel it. I didn't know it, but I was acting out. I was probably not a lot of fun to be around, but still from the outside, everything looked fine. Now, fortunately, I didn't burn anything to the ground. I never jeopardized a patient life. I never showed up drunk. I never did anything stupid like that. And that's why my story is not as dramatic as some that I've heard. But I had the potential to hurt a lot of people. And I probably did hurt some people along the way, emotionally. It doesn't have to be that way, because while there are some dramatic stories, you can find this, what I would call a soft bottom, in a much more gentle way by just opening your eyes and being open to the idea that some of these things might be occurring in your life. So some of these more dramatic things, are sometimes picked up by like social media, certainly potentially legacy media, and certainly social circles. And when you hear some of these crazy stories, a lot of times you just think like, man, how could that person do that? Like, how do you get to this point? And you see some of these stories, and these are the sad things that come to fruition for some people, which is you see physicians that actually do show up drunk at work, right? The airline pilot that tests positive for drugs after flying, like, how did that happen? The coworker who's having an affair at their office, you're thinking, man, like, how did you get to this point in your relationship that now you're having this essentially open affair in the office? I had a colleague in training who had child pornography and was involved in a child pornography ring, right? And like you look at some people and you're like, man, how did you get to this point? You see people that will gain, dozens or hundreds of pounds for what seems like no reason. But then ultimately, there are so many different versions of these stories, right? There's so many different ways that you can react to the social circumstances that are around you, and you can fail to identify what you need in order to stay on your mission, what you need in order to stay true to those around you and to the purpose that you're living in your life. So once you sink into that victim mindset, anything can be justified, and is. We see it all the time, right? We use terms like addiction, mental illness, and those things do exist. And I'll probably have a discussion about mental illness and other things on another day. But for now, let's just talk about how to reverse direction. How do you stop drifting? One of the quotes that I like in this space is by Jim Rohn, and he states that your life does not get better by chance. It gets better by change. So you can call it whatever you want. You can call this by the grace of God. You can call it a spiritual path. You can call it a lot of things. But it always starts from within. It always starts from making a decision to make a change. So for me, again, I'll tell you my story. My emotional bottom led to a need for a change. I couldn't have, and most people probably can't, do it alone. I needed to understand my patterns before I could change them. The first time I heard victim mindset was long after I'd been in one, right? But the most powerful tool for me was coaching. I'm a big believer of the power of coaching, whether it be business, personal, athletic, whatever. Many people will talk about therapy, and there's certainly a place for that. But I like coaching because coaching will push, with the right individual, will push you in a forward direction rather than spending a lot of time talking about the past, right? So sometimes that's important, but ultimately I want to know, how do we move forward? How do we create measurable and meaningful steps along the way? How do we get to the next step? That's why I built coaching into our program. That's right. We have a physician-led program that is dietitian and coach driven, because it takes the frequent coaching to be able to drive people toward their goals once those goals have been realized. So once you identify that starting point and you've done the work to wrap your mind around what your true mission is, what your unique gift is, then it's just a matter of knocking out small victories along the way. For those of us that are goal driven, that's easy, right? And I said this then too. Give me a goal and I'll knock it out. But if I don't understand the goal, I can't get there. And that's true for all of us. Setting clear goals, but also setting clear boundaries with substances and behaviors that serve you or don't serve you. And this will look different for everyone. So for me, I recognize for me that alcohol didn't serve me. I didn't have a capacity to drink moderately. And ultimately what I know now is that it doesn't serve anybody, even to drink moderately, for whatever you want to define that as. But for me, once I decided that it wasn't for me, I was able to walk away from alcohol so easily, right? And this is where I see so many people struggling with this idea of addiction and recovery and how alcohol is such a challenge. And again, that's a conversation for another day. It's a tough one. But once you make that decision, you can simply walk away. You can decide that you have free autonomy and you can choose to not be a victim of it. And that's what I did over 2.5 years ago with alcohol. And I don't crave it. And I never have, not since that first day. For many, this requires additional work. It may require different support groups. And again, a topic for another day. Other things for me is that I recognize that I was using television in kind of a similar way. This was sort of like as streaming became very commonplace. And so my wife and I would find ourselves kind of binge watching programs, not often, but probably too often. And so it was easy, though, to create boundaries here. So this is something that we still have in our lives. We still watch TV occasionally, but not a lot. Well, we will watch a season of a show, but it'll take us weeks or months to get through it, rather than binge watching an entire season in one night, right? So we're able to create boundaries. My alarm goes off on my phone. Hey, it's bedtime, time to go. So we can do that. And again, that's something that whatever it is, social media, different forms of entertainment, gaming, whatever it is, just creating those clear boundaries. Understanding that the boundaries have to be set for you to protect your mission. And once you start protecting your mission, your life can be that much more gratifying. So for me, once I identified what my mission was, what my purpose was, how I could serve those around me, it could be my family, my kids, my wife, my patients. Now, all of a sudden, everything looks different, right? So now I'm no longer drifting. I have a purpose. I have a mission. And it is so much different than drifting through even a successful career. How I feel How I go through my day, how I end my day, and how I start my day are completely different. I don't have a reason to run or to hide. I'm not looking for an escape from my life. I love my life. I love what I have. And I love what I'm building. And it's a very, very different scenario. And again, this will look different for everyone. But I strongly encourage anyone who recognizes that they are using substances, entertainment, behaviors, anything as an escape from their life, to use the same principles that we use in healthcare. Let's use this idea of a root cause analysis and figure out why you need to escape in the first place. What are you running from? Fix that problem, and then the thing that you're using to escape loses its value. If you haven't read the book Outwitting the Devil, it could be a great tool. Now, it's probably not for everybody, but I thought it was really interesting. It's a quick read. It might be a little hokey. Just again, it's written in 1938, and it's the author talking to the devil. But it is an interesting read and an interesting visit through this feeling of drifting, and how the author looks at drifting as a way for people to miss out on their life. And again, this is what people mostly do through their entire life. Drifting is simply avoiding reality. It's avoiding pain, but in the process of doing so, you're missing out on joy and you're missing out on happiness. We shouldn't hide from our lives, but rather embrace our life. It is a gift. We should celebrate the journey that's been given to us, no matter what it is. We likely chose to be here. We likely chose this journey. So let's enjoy it. It's a ride. We choose to be on this ride. If I could make a recommendation for anybody watching this, and you feel like maybe you are drifting through life, find purpose, aim for optimal, not average. And if you need help, ask for it. Because remember, we are created for greatness. We should be seeking optimal, not average. So don't be afraid to be extraordinary, because that's what it takes. All right. I know that drug on and on, but here's the end. If you haven't already and you're on YouTube, please click the subscribe button. Helps other people to find the same content. If you haven't joined our HealthSpan Nation yet, head over to drduglucas.com. Check out what we have to offer you there. It's where you'll find all of our discount codes, our resources, our weekly Q&A, and our group of people that are seeking to aim for optimal, not average. So if you're not there, I hope to see you there soon, and I will see you on the next episode.
This presentation is for general informational purposes only, does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this presentation are at the user's own risk. The content in this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. See you next time.